October is Breast Cancer Awareness Month, and the Nebraska Cancer Coalition is working to increase awareness of the importance of breast cancer screening. We are joined today by Dr. Todd Hlavaty, a radiation oncologist with Callahan Cancer Center in North Platte. Good afternoon. How are you?
Good afternoon. I'm also down in McCook at the Anderson Cancer Center.
Okay, very good. Thank you. All right. Well, let's get into this a little bit. A statistic that we know is that in 2022, a little over 67% of Nebraska women 40 years of age or older had a mammogram within the last 2 years. That statistic, that number is actually lower than the screening rates in 2022. So I want to ask you this, Doctor. When should women start getting breast cancer screenings done?
And that's the most important thing. The United States Preventive Task Force said women should start at age 40. And for the longest time, that was pushed to 50, but we worked hard with legislation to actually lower to that to 40. There are exceptions to that if a woman's at high risk. High risk defined as genetic predisposition. For example, a mother that had breast cancer at age 30, it should start earlier. And that screening should be done every 2 years. That's a very bothersome statistic because 1 in 8, and this is hard to believe, but it's true, 1 in 8 women will develop breast cancer in their life. So when I walk into church on a Sunday and I look around, and I've treated a lot of people in this town, it truly is a statistic that holds up. So we know that if 1 in 8 women develop the disease, our best chance of treating the disease and curing the disease, quote unquote, disease-free survival, is to find it early. And the only way you can find these early is with mammography, because by the time they become palpable, they're more advanced than you can see on a mammogram, or with women with dense breasts, a breast MRI. So what's bothersome is there's a big discrepancy here that we're dropping, even in the last couple of years, of people not getting screening done. And we don't know why that is, because that they're covered by insurance or Medicaid or Medicare. And there's no reason you can't go in every other year. In addition to that, if you have any symptoms of breast cancer, any palpable masses, any change in the skin density, any dimpling of the skin, you need to come in right away, and we'll do a mammogram right away. We don't wait that 2 years. We go in and address that problem immediately.
One of the things that, as we've been talking to people about this, that's a big part of this is heredity, right?
Oh, there's no question about it. We know, as knowledge goes along, we know there are certain genetic factors that are going to lead to increased breast cancer findings. One is BRCA1, BRCA2. Those are 2 magic terms you'll hear. But I predict in the next 10 years, we'll know much more about the disease, and we'll know who's at genetic risk. Who do we really need to screen earlier than age 40?
Interesting. Now, I think it used to be that a mammogram was kind of a scary thing. That's changed, hasn't it?
I think it has changed a lot, because if you talk to patients who've survived the disease and realize if you catch the disease early enough, you may not need chemotherapy. If you catch the disease early enough, and maybe it's just a surgical procedure or surgery preceded by radiation therapy, which will lead to very high cure rates in excess of 90%. In addition to that, there are certain breast cancers that can be only detected on mammogram, like ductal carcinoma in situ.
And that's one of the things that we've talked with some of the other people that they didn't, they had no indication until they got a mammogram that there was something that was going on, and so that's what makes it so important. Dr. Todd Hlavaty, thank you so much. Are there any other thoughts that you have that you want to let people know about during Breast Cancer Awareness Month?
We can save almost 20% more people if they went in for screening on a regular basis, and that breast cancer death is reduced by a half, for those who participate in breast cancer screening. The stage of disease is directly related to survival. So if we have a stage 1 or stage 2, we detect early in the disease process, survival is in excess of 90%. And most of the people I see in church are the result of those who had breast cancer screening. I think you also have to take into account there are certain risk groups that are at higher risk for breast cancer. And non-Hispanic Black women are extremely high risk and have and should be considered for early breast cancer screening. And we know that this is directly tied into survival. You know, the scariness for me as a physician is that you're coming in too late. When we know you have disease that has metastasized or spread outside the breast into other areas, we know those patients are terminally ill. We have put a lot of money into research to making chemotherapy a better lifestyle for them, but they're not going to survive the disease. So the way to survival the disease is to go for early diagnostic screening. Bilateral mammograms are not that big a deal. They should be done on a regular basis, and the national guidelines or the preventive force guidelines are to do it 2 years starting at age 40 unless you're at high risk, and continue on. And I think the upper end is being debated now because people are living longer, their quality of life is better. And so we will even do mammograms in those older patients because, you know, people say this all the time, 80 is the new 70, 70 is the new 60. And we have patients who are active and have active lives even at 90. And so those people are even being considered for screening.
Well, certainly, as you look at that number of 67%, as we talked about earlier, we'd certainly like to see that at 100%. And there's just, as you've talked about, there's just not a lot of reason why it shouldn't be, right?
Oh, to tell you the truth, they're getting better and better at mammography. And those techs are getting better and better at doing compression views of the breast. And, you know, I think it's not, I mean, I'll tell you, it's not going to be a cakewalk, but it's really not that bad considering the outcomes you're saving your own life. I think another important thing is the best doctor in this whole relationship is the patient themselves, because they can do, you know, monthly or weekly screenings on themselves in while taking a shower or a bath. And if they detect any abnormalities, go right to the doctor, because they know their breasts better than we know their breasts. They know what they feel like. They know what to expect. And to tell you the truth, a lot of times women that we treat are responsible for saving their own lives.
That's good stuff. That's good advice. Dr. Todd Hlavaty, thank you so much for coming in today and during Breast Cancer Awareness Month.
Thank you very much for having me.